Dear friends, now as per commitment which we made with you yesterday, and yesterday I was having only one scholar in my company. The man is working in the hospital now, and his name is Yusuf. What a beautiful name, and he seems to be embodiment of Husn. The word Yusuf means the one who is beautiful. So let's have a small conversation with him.
Thank you so much, sir. This is your greatness that you are calling me a scholar.
Did you prepare MDCAT at home or you joined some academy?
I joined an academy in Multan. I remained there for 1 month. You know, those professional academies, they were doing something different than actual syllabus, like teaching extra things. True. And making an impression that this MDCAT is a certain difficulty level, this, True. That. But in that year, I could not get through the exam. Okay. I got less marks. Then I decided to work for 1 more year.
Okay.
And in second year, I didn't join any academy. I did it myself, and
okay.
The idea worked.
Excellent. And the second thing which I picked from your point, that you were so serious now in getting admission over there, in getting enrolled, So you became serious, you studied at home, and you followed the paper pattern, and you prepared, only the required data, and it worked. Today, very lucky to have another great, professional in my company. So before we discuss the topic, the MDCAT, it's better to know about the man.
My name is Dr. Masroor, Sadiq.
Okay.
I attended MDCAT that time in 2011.
Okay.
I got admission on merit in Sheikh Medical College, Dearest.
So man, I know that you are basically from Dearest, and you are working over here right now in Jauharabad. So what's the main difference which you see between the two cities?
Kind-hearted people. The Jauharabad,
okay.
The people in Jauharabad are also very good.
No, actually, they say the people can understand. No, because he paused, and it was very difficult, to say the thing that the people over there in Jauharabad, they are very kind-hearted. Yeah. Okay, I can understand because I have lived over there, for years,
No, seriously, I have noticed only 2-3 months you cannot even.
Okay.
Quickly go to the results and have perception about some city. So I have no even friends in Jauharabad except 1 or 2.
Okay.
We live at our flat with Dr. Yusuf and 6 other people.
Okay.
We have great company there.
MashaAllah.
In the hospital, do our job honestly.
MashaAllah.
Hard work there. We go for our maximum effort is to serve the patients.
Sure, MashaAllah.
And this is the whole story.
Okay.
And Dr. Yusuf, he was convincing me for the last 3 days.
Okay.
That we should go to
respectable
firm.
And finally, you got successful. So really nice to meet you, Mr. Masroor. Before that I move forward, another point which that the man, he's full of praise for you, that he is of the opinion that he's very lucky, to have a friend over there in the hospital like you. But what's your point of view about Mr. Masroor? What is the quality which impresses you the most? You can't share your secret, no.
Now he's going to lie anyway.
Yes, sir.
One thing I should mention here that he is very careful about his patients.
Okay, MashaAllah.
He is very ethical doctor.
MashaAllah.
Truly speaking, he is very careful.
True.
He does not compromise over patients.
True.
Patients' health.
MashaAllah.
Over anything. This is his quality, I think.
True.
Should be mentioned.
So here, I will share that some Persian quote with you, some proverb in Persian, Man tura haji bagoyam, tu mara haji bagoyam. It's you to call me Haji, and in turn I shall be calling you Haji as well. You did your MDCAT in 2011, and Mr. Yusuf, you appeared or you qualified your MDCAT
2012.
11 and 12. I think now that is a year, then you missed the opportunity and you couldn't score whatever, the required,
in 2011.
that is now. Masroor, what's that, MDCAT?
It's all about determination and your mental strength. It does not only depend on your hard work, but the way you appear in MDCAT and when you go to the exam, you should be much confident.
True.
That most of the questions are from the books. Only even they pick up the lines and like we used to fill in the blanks in 5th and 6th class. They're like that, especially in biology. But English and physics, I think they are difficult. They are more difficult to attempt.
His point of view that it's not a matter of hard work. Actually, what makes difference is determination, your commitment, and the approach you reach the exam with now. I think whatever I could go. So what's your point of view?
Yeah, he is right that determination, the way how you attempt the paper, these all things matter. But basically, it's your background knowledge. It's what you have studied in your pre-medical in 2 years. Although it is a type of exam based on just cramming, I would say.
True.
So only those who have studied those books thoroughly and completely, and they know each and every line where it is written, and so they are their chances of getting through this exam are higher than those who will rely just on their concept, no technicalities asked in this exam. This is just what you have studied in your books in 2 years. Nothing to join so-called
academies
and those who are claiming. They have just made it a game of nerves and just creating a panic in the minds of students. There's nothing. They have just studied their books. They should revise those books. They have already studied. If they can remember those things.
So this remembrance shall be very helpful for them. You simply recall the data now and tick now. See, do you agree with this point? The man is actually saying that
some points, but I would also like to disagree at some points. I give you an example. When I was doing my FSC in 2 years, we were in a section called M1, the toppers, shining students. And most of them were hardworking. I think they were more hardworking than me or my other friends who got admission in that year. We out of 80 students in my class, about 39 students. We got admission in government medical colleges. And half of them were those students who was not so hardworking. Even our position holder in our class, he could not get admission in medical college. Another example of my brother, he was not so hardworking. He attempted MDCAT in 2015. And there were 3,400 seats at that time. He attempted that exam. He could not get admission in Punjab.
Got it.
Then he attempted an entrance test for Federal Medical and Dental College, having 40 seats in for Punjab. Punjab quota. He had 40 seats, and he got admission there. He was not so hardworking, and he was intelligent, very cool, but he was not hardworking. Now I think the difference is I went with him to the center when he was attempting MDCAT. He was not so confident. Then me and my father boosted him, and he tried very hard for the last 15 days. When he appeared for FMDC exam, his confidence was much higher. Then he got admission.
So I think he will be happy that 2012 and onwards people got getting more marks MDCAT because of this I would say
specification, you can say,
specified syllabus and those who could cram it, they were more likely to get.
So the lines are given, contents are given, no, as it is due to Mr. Yusuf, no, it's be to cram it, no, so more cramming. If you're good at cramming, so you will be able to score your, no, that high marks, no. If you're poor at cramming, so as you have to put no data over there, exact as it is so. If you're not in the habit of cramming, so you will be losing your marks.
For example, they provided us with 800 and something like English words. We crammed it and we find their synonyms and everything.
Crammed, you mean rata. They couldn't speak English and something like that.
Again, that will be very encouraging for them. So he has been working for 9 years now, and still he is poor. As I don't agree with you, but no, I say that if you think that you're so poor, so for such a man who's so poor at English, now if he can qualify, why can't I? It will be very encouraging for them. So dear friends, don't worry, no. Mr. Yusuf, you know, he appeared with you in 2011, no, but unfortunately he couldn't meet the requirements. Any one thing which you think that which was missing, which led to his failure, or which proved to be as one of the factors of his failure in his first attempt of MDCAT? So you didn't share, sir. He met me 2 days ago, but he shared each and everything with me.
I think these things are old, and we are discussing our new problems nowadays, like FCPS and like that.
Anyway, anybody, he does not talk about his failures.
So this is the reason I think, you know, that Mr. Yusuf, he decided not to share his, you can say, his failure, no? But what do you think? What were the factors which led to your failure in meeting all the required marks, no, in your first attempt of the MDCAT?
I think the main factor was there was no one to guide me. I joined an academy, and they were kind of making the things difficult for us. Instead of facilitating and making us think in a right direction, they were creating panic and this and that and out of syllabus questions and those things.
So many people, so many young know that the future doctors are going to appear, no, next month, no, they have the same exam you're talking about. So anything which you would love to suggest, no, you would love to advise them what to do so that they can now qualify the test?
I think only be positive. And when you appear in the exam, have faith in yourself.
True, that's very important. Really, it impresses me a lot, you know, that having faith in oneself, it contributes a lot, you know, to believe in yourself. Or you can say now that if you're committed, if you're devoted, if you're determined, you know, if you're no fear of failure, no. So again, it contributes. So certainly your suggestion or your advice, no, to the students, no, to this.
One thing I think we should make clear that there are certain changes now in the system. They have changed the university which is taking the exam. Previously it was UHS, and now it has been assigned to nuns. There are, I think, people were talking that there is a difference in syllabus also. So students should focus on their syllabus, and don't be nervous if we got the admission. If
we were able to get admission, why can't you? Unbelievable. See, Dr. Yusuf is of the opinion that if he can score all this, no, why can't, you know?
Same advice.
Bad at English, but we are not bad doctors.
Because that's skill, no? And it's communication. It has nothing to do with that.
The same advice I used to give to my juniors in medical college. All those who were close to me, my juniors, they when I found them nervous in their exams, I used to say this: if I could pass this exam,
unbelievable. See, so let's know the last point. Before actually I will be having that few lines about your hostel life. Is there any need of such test known as an MDCAT after having qualified FSC and they are studying the same syllabus again re-cramming that the same books and what do you say?
I think yes.
It should be.
It maintains the standard of medical in our country, because it's not so easy.
True.
It's very difficult.
And it's you to if you're poor at that, so you will be playing with the lives of innocent people. I can understand. See, what's your point of view, brother Yusuf?
I agree with Dr. Masroor that if a person cannot cram these,
you cannot go through the anatomy and physiology and biochemistry and
be able to memorize all those kind of big books and this will be difficult.
So friends, brother Masroor is on the point of view, he is not going to, you can say, represent you. I am of the opinion that there is no need of this test. Just we to standardize our system, FSC system at colleges. But you said Mr. Masroor is not of the same opinion. And see, doctor is with doctor, I am alone. So Mr. Yusuf seconded Mr. Masroor. I respect the opinions of both my brothers. The younger to him, sure you're younger. I'm 72 model and you are
93.
Brother Masroor, you were born in which year?
1994.
Tomorrow we shall be discussing a role of entertainment in our lives. Agree?
Inshallah.
Brother Yusuf, agree?
I agree.
Thank you very much. See you tomorrow.